I'd like to welcome Regional Chair Jim Bradley to the program this morning. Welcome, Jim.
Good to be with you, Mike.
Jim, your State of the Region address from a couple of weeks ago, what was it like to do that without your usual gathering of 500 or so people?
It was dramatically different. It did not have the contact that one usually expects in those situations. You're not looking directly at an audience. But listen, that's the way things have been the last couple of months. When we communicate now, we do communicate the way you and I are communicating right now. But it was different, and the message still got out there. Everybody saw the video who wanted to see it. Then there were questions and answers after for Ron Tripp, the CAO of the region, and Dr. Mustafa Herji, the Chief Medical Officer of Health, and myself answered questions from members of the Greater Niagara Chamber of Commerce. So it turned out working as well as it can under the circumstances.
Dr. Herji, what can you say about his handling of the COVID-19 crisis since it began?
Well, it's been a full-time job for him, and he and his staff have been working overtime to try to deal with all of the issues that happen to arise. And he keeps in communication with other medical officers of health around Ontario, with the Ministry of Health of Ontario, and then suggests things to members of council. And to this point in time, people have not been challenging the medical advice because, of course, everyone always says the politicians shouldn't be making political decisions. They should be making decisions based on the best advice of medical authorities and science authorities. Certainly that's what Premier Doug Ford has been doing in Ontario.
Economic recovery is now taking the forefront of the focus here. What does Niagara have to do to get the economy locally back on track?
Well, stage 2 was a big help, going from stage 1, which is essentially a lockdown, to stage 2, which allowed some careful openings, started us in the right direction. Just thinking of one particular business itself, and that is the restaurant, the hospitality industry. Restaurants now able to go out in, at least outside of the restaurant, in their patios. Their landlords, where they have been pretty accommodating for most of them, so they've been able to expand out onto sidewalks and so on. That's a help. Stores that have an opening to the street, now we have, of course, in stage 2, shopping centers can open. So all of these things are going to be very helpful. The next will be stage 3, where there's a much more extensive opening, but that's going to take. And of course, the federal and provincial government have a substantial role to play, both in terms of assisting municipalities, and all municipalities are looking for that, but in particular, so far, assisting business and individuals to cope with what has been essentially an unprecedented situation.
Toronto and the GTA area is mandating masks. Mayor Walter Sendzik in St. Catharines wants to do the same in that city. Do you feel it would be a good thing for the region to force masks in public?
That will be a decision of council. Certainly, there's consultation going on now amongst the mayors who represent each of the municipalities, because they are the head of the municipality in their area, and certainly regional councillors are chiming in as they should. So that would be a decision, but I'm going to tell you that it will not be based on the recommendation of Dr. Herji. In other words, he has not said that we should be doing this. It will be a political decision made. So I hope that those people who say that we should only be basing our decisions on scientific and medical advice will understand that this will be a political decision. But I think there's a lot of support for it, particularly in confined spaces. Don't think anybody's talking about it out in the open.
Jim, the idea of a government, a local government with too many politicians has come up again. Last week, a group of local business owners approaching the region and saying that now is the time to make these changes to save some money and, help with this economic recovery. How does Regional Council receive what the business owners were trying to convey last week?
The region is always, as it is with the local governments, always looking for ways to become even more efficient and save more money. One of the situations we confront at the region is the kind of services we provide are essential for the public. If you think of nursing homes. We operate 8 nursing homes. I've heard nobody say we should be cutting back there. We operate ambulance service, police service. We operate the sewage treatment plants, the water treatment plants, public health, social services. All of those have been really stressed during this particular time. So as I say, our CAOs, that's the Chief Administrative Officers, are meeting on an ongoing basis, looking for ways in which we can save money. But we're also advocating on behalf of those businesses with the federal and provincial government, both for direct assistance to the businesses, but also to municipalities to allow us to cope with the situation here. Remembering the only tax that municipalities have is the property tax. The federal and provincial government have a variety of taxes, many of them which take into account a person's ability to pay, as opposed to the property tax, which the bill comes whether there's an affordability or not. So we're always looking at that. We're listening to input from a lot of different people, from that business group, from other business groups, from those in the social services area. We had KPMG come in to do an assessment of the region. They, in their report, said only 8% of the services we provide, or of the budget at least, for the services we provide, is discretionary. The rest is mandatory and essential. So it's a major challenge, and that's why we're advocating to the federal and provincial government to provide us with assistance, and all municipalities across the province and the country are doing the same.
Thanks again for your time today, Jim. It's a pleasure to touch base with you during these difficult times. Thanks again.